From the graduate program in journalism at the University of Western Ontario, this is 30 Minutes.
On today's program, we witness one man's uphill battle for life. Welcome to 30 Minutes. I'm your host, Andrea Hartling. Any form of cancer is traumatic, but getting a rare form puts you in double jeopardy. As Ted Cooper explains, not only are you in danger of dying, but the Ontario government isn't likely to pay for your drugs.
Cancer?
If you're going to get cancer, and especially if you're going to get cancer in Ontario, you better get one of the popular cancers. So go for breast or lung or prostate or colon cancer. And that sounds really harsh because I wouldn't wish those diseases on anyone. But those diseases have the treatment evidence, they have the volumes of data, they have the patient support and advocacy groups who will help fight for the treatment option.
Gary White's lungs are filling with fluid, a side effect of his rare form of kidney cancer called papillary, a disease that affects only 500 Canadians each year.
Is not a curable cancer, but it's one that with treatment can certainly be prolonged. And I think that's what Dr. Mackenzie's ambitions are, and so far so good.
Dr. Mary Mackenzie is Gary's oncologist. She says he needs to try a new medication.
He has already had 2 other drugs with respect to his kidney cancer, and they certainly controlled his disease for a while, but the time has come to try a different drug.
And that medication is Nexavar. Nexavar costs about $6,000 a month and is usually taken for 6 to 12 months. Unfortunately for Gary and other Ontarians with rare cancers, expensive drugs like Nexavar are not automatically covered by the province. According to the Cancer Advocacy Coalition of Canada, Ontario is falling behind other provinces when it comes to covering new cancer medications.
Patients with rare cancer are commonly penalized. They're commonly excluded from trials for the reason that they're not a big market.
But even when drugs aren't covered by the Ontario public drug programs, there is supposed to be a safety net to ensure that people get the medications they need.
If we want typically a more expensive, newer drug that is not often covered, we go through a process called a Section 16 application, which involves writing a letter that goes through a process called an individual clinical review.
Along with Gary's Section 16 application, Dr. Mackenzie submitted 5 clinical trials that demonstrated the benefits of Nexavar to patients with papillary cancer. Despite the evidence, Gary was denied.
I felt that I'd given very clear and compelling, airtight evidence that this drug may benefit him. And to have that door closed was extremely disappointing.
I've always believed that if you got into a situation where you needed a drug, a life-saving, life-prolonging drug in this province, that you would have access to it one way or another.
There is a certain lack of accountability, and the reason that bothers me is when, as a physician, I prescribe a medication, I have to be ready for any adverse consequences of that recommendation. I have to be prepared for the side effects and know how to manage them. I have to make the patient aware of any risks that may come with taking the drug. But there's no accountability for the person who decides that the drug is going to be denied, and what may be the adverse clinical outcome of that, and no clear appeal process.
And no great interest to talk about the issue. We contacted the Ministry of Health and the opposition health critic, but no one was available for an on-camera interview. However, in the rejection letter that the Ministry of Health sent to Gary, they did say the reason he was rejected was because there is no evidence that Nexavar helps papillary patients. But Deb Maskins is living proof that people with papillary cancer can benefit from Nexavar.
I'm clinically free of disease, this is absolutely history-making for kidney cancer, because I shouldn't be here. The real truth is the only reason I'm here is because I have private insurance. If I didn't have private insurance, I would be in exactly the same boat that Gary White is in. And without Nexavar, I hear the disease progressing in him every time I talk to him. I can hear the disease in his lungs, the fluid that's building up. That would have been me had I not been saved by a private health insurance plan. And that just strikes me as being so fundamentally wrong.
Gary also has private insurance, but his does not cover the high cost of Nexavar. So without enough evidence for the ministry to give him the drug his oncologist says he needs, Gary is forced to try an unproven treatment. And Deb Maskins feels that's a travesty.
I hate to say this, but I think it's about money. I know that the Ontario government has a responsibility to taxpayers, but we're not asking for a lot of money here. We haven't asked for hundreds of thousands of dollars of treatment. What we've asked for is give Gary a chance to live.
When it comes to accessibility to these drugs, they are expensive, and but we can't exclude people. We have to include those with in minority groups because of rare subtypes.
For 30 Minutes, I'm Ted Cooper.
That's all for today's program and this season of 30 Minutes. From the graduate program in journalism at the University of Western Ontario, thank you for watching.